Pharmacy Skills Lab Communication Assessment. The actor in this video is a real student who was following a script. The following depiction does not reflect the student's actual communication skills.
Hi, I'm wondering if you can help me. I have a question about diarrhea that my daughter's experiencing.
Oh, okay, yeah. Do you want to tell me a little bit more about that?
Yeah, she woke up this morning and she was fine last night, but she woke up this morning with diarrhea. I'm not sure what's going on, and to be honest, I'm not really sure what I should do about it.
Okay. What have you tried?
Nothing. We've just been kind of watching her to see what's happening, and it's continued, so I'm not sure
excellent. Yeah, and has she had this before?
Not really, not like this.
Okay.
Yeah.
How old?
She's 3.
3? Okay. And so you haven't tried anything. Do you have other kids? Have you tried anything?
No.
No? And any medication she's on at all?
No.
No? How about any medical conditions?
No, she's healthy.
No?
Just a diarrhea.
Okay. And any allergies at all?
Not that I know of.
Okay. And so I know I asked about medications, but any herbal products at all?
Mm-mm.
No? How about vitamins, things like that?
I do give her vitamins. She takes a vitamin every day.
Okay,
Yeah.
well, yeah, that's good. Okay, so the diarrhea, hey? Would you say she's dehydrated at all? Like, is she like her skin turgor?
I'm certain.
Like when you grab the skin, does it bounce back or does it stay up?
I don't know. I haven't done that.
Okay, what about like sunken underneath her eyes? Like kind of like hollowed, you know?
I don't think so. I wouldn't just, no.
Okay, and not to scare you or anything, but like any like blood or mucus in the stool at all?
No.
No? Okay. And how many bowel movements is she having?
Since this morning, 3.
Okay.
Yeah.
And any fever, anything like that?
No, I haven't measured it since this morning, but this morning she didn't have a fever.
Okay.
Yeah.
And so no fever, diarrhea. Is she up and playing around, things like that?
No, she's a little quieter than normal. Yeah.
Okay. Has she been on antibiotics at all?
No. No, actually, she's never had antibiotics. Yeah.
Oh, okay.
Yeah.
Okay, so she's 3 and about 3 bowel movements. She doesn't really sound too sick to me, so that's good to hear. I think we do have some products that might help. We also have, like, do you have apple juice at home?
I can get some if we don't.
Yeah, so kind of what I'm thinking, leaning towards, because I don't think this sounds too serious, personally. More serious enough that you came in, so that's good. But I do think that going with an apple juice, you can take half a cup of the apple juice and put it in a cup of water and do that a couple times, about 3 times a day for her. Okay. We just want to make sure she's rehydrated.
Okay.
Watch out that she's not having any more of a fever, or if she gets, you know her better than anybody, so if she's not feeling good, fever, worse diarrhea, then maybe take her into the doctor.
Okay.
Maybe emergency room, you know her better than anybody.
I think she's a little off, but she's just kind of quiet.
Okay.
She's not...
Yeah, I think if things don't change, it's fine right now,
Okay.
but if it doesn't go away in 2 days, I'd probably take her into the doctor.
Okay.
Does that make sense?
Sure.
Sure?
Yeah.
Okay, and are you comfortable doing the apple juice?
Yeah, she's drinking. I've been giving her water because she seems a little thirsty.
Okay.
Yeah.
And she's still frequently urinating, things?
She did go to the bathroom this morning, and yeah, I think she's okay that way.
Okay. Yeah, just watch how much water she's intaking, and still kind of like things I said, like the turgor and like sunken eyes.
Okay.
Also, maybe she has dry mouth. What else? Yeah, stuff like that. Just watch, and then also too if she gets more sick, and yeah. Can she eat food right now?
Doesn't really have an appetite.
Okay.
But yeah, sometimes when she gets sick, she doesn't have an appetite.
Okay, I try to figure out, maybe what she can eat and then go with that. But as for right now, I think the apple juice and water would be good. Give us a call if you have any questions.
Okay, I'll do that.
Awesome.
Thanks.
The feedback provided in this video is comprehensive. In many situations, it may not be feasible or practical to provide such comprehensive feedback to a learner. Assessors should aim to provide the most comprehensive feedback possible with the time available, focusing on the most important aspects of what went well and what should be improved. Let's take a look at the feedback that would have been provided to this pharmacy student. Here's what went well. The student communicated in a respectful manner. The interaction was organized and the flow of the interaction appeared to follow the patient's concerns. For example, the student immediately collected a history of the diarrhea before asking background questions about things like allergies and other medications, since the mother was clearly worried about the diarrhea. The student did double back a couple of times to ask questions about symptoms that she forgot to ask initially, but that is fine as long as it is not frequent or distracting. She maintained suitable volume and tone throughout the interaction. The student responded appropriately to some of the patient's cues and attempted to show empathy. She recognized that the mom was a little worried about her child and she anticipated which questions may scare the mother and prefaced them appropriately. This was done while asking about the presence of blood or mucus in the stool. She also asked the mom if she was comfortable with the apple juice suggestion, making an attempt to elicit her preferences. The student also regularly repeated back what she had heard the patient say, which shows that she is listening and making an effort to understand the patient's concerns. The student gathered information effectively and efficiently through the use of open-ended and closed-ended questions. Open-ended questions were used very effectively at the start of the interaction to give the patient a chance to tell her story and collect a history of the issue. For example, she asked, "Do you want to tell me a little bit more about that? And what have you tried already?" She proceeded to follow these open-ended questions with several closed-ended probing questions to fill in the gaps that did not come out naturally from her initial open-ended questions, particularly in ruling out worrisome red flags. Here's what could have gone better. The choice of language and nonverbal cues were unsuitable for the context. She used medical jargon and did not change the use of medical jargon, such as the word skin turgor, even after the patient expressed confusion. She did not maintain eye contact as often as she could have. During her information gathering, she used terms such as, "Does she have a fever?" or anything like that. Patients will likely not know what anything like that would entail. She cut the patient off mid-sentence a number of times, and she used some double-barreled questions, such as, "Do you have any other kids? Have you tried anything?" She also used lots of unnecessary ums, uhs, and okays that were distracting and may have portrayed a lack of confidence. At times, the student's communication did not convey empathy or care. Her demeanor and body language came across as being casual and informal in a situation that probably required a more serious approach. This could have been perceived by a very worried mother as indifference or that she was not taking the situation as seriously as she should. The student missed some opportunities to be empathetic. She did not validate or acknowledge how the mother was feeling at the start of the interaction. To achieve this, the student might have said something like, "It sounds like you're very concerned about your child's diarrhea, and I'm glad that you came in today to ask for assistance." She also made comments such as, "Oh, she's not that sick," which in some cases the mother may have felt like her concerns were being dismissed or not understood. Based on all of this feedback, this student was awarded a communication achievement score of G, or growing. In this case, a G was awarded primarily due to the multiple issues related to verbal and nonverbal communication, making it impossible to conclude that this interaction illustrated a proficient level of communication skills.